My name is Aditya Nair. My today's topic is primary wound healing. So let's start with the introduction. What is wound healing? So wound healing is a physiological process by which the body repairs the damaged tissue. It restores the integrity of the skin or other affected tissue following injury, trauma, or surgery. So, whatever type of wound it is, your body has its own physiological process which restores the function, the normal function of your skin, the normal texture of your skin, just does it by itself. So, that is what is wound healing. There are two types of wound healing: primary wound healing, secondary wound healing. So, what is actually primary wound healing? Primary wound healing is the type of healing where the wound is sutured primarily with clips, sutures, or adhesive materials. Healing occurs with minimum scarring, just like wound healing during a mosquito bite, right? While a mosquito bites, that particular wound is healed just there is no scar. Sometimes no scar is involved, sometimes there is. Not much of the time there is no scar formation. So there is minimal scarring, right? And second is secondary wound healing. Secondary wound healing is when there is irreparable skin loss or the wound is infected and breaks open. Healing occurs with more scar tissue. So during this happens during when there is a significant tissue loss, right? And or if an object is already inside that wound and it is those edges are not being approximated because of that object. Okay, and examples are tooth extraction sockets or severe burn injury. Stages of primary wound: they are homeostasis, inflammatory phase, proliferative phase, and maturation phase. So what is homeostasis? Homeostasis is which is a process which starts when the blood vessels affected by trauma gets constricted. That is to stop the bleeding, to stop the further blood loss. So what will happen? Your blood vessels will get constricted, right? The platelets will aggregate and it will form a platelet plug. Okay, platelet plug will be formed, which will be reinforced by fibrin, which is a protein mesh called fibrin, and a blood clot will be formed, and this stops the further blood loss. So as you can see in this video, the platelets are getting aggregated, yeah, and a blood clot is getting formed. Second is inflammatory phase. So after adequate clot has formed, the stage of inflammation starts. White blood cells, particularly neutrophils and macrophages, clean the wound site by removing the debris and bacteria. So in between this, there will be, when the inflammatory process starts, there will be release of chemokines and cytokines. Okay, and these will recruit the immune cells. Blood vessels will dilate and become more leaky and permeable, and these particular immune cells will sneak in and they will remove the debris and whatever microbes or bacteria has already entered inside, right? So the next next process is proliferative phase. Now, in the proliferative phase, the granulation tissue will form, which consists of the new blood vessels, fibroblast, and inflammatory cells, right? Now, these epithelialization will begin from the wound edges and the granulation tissue gradually covering the wound surface. Right. Now these particular fibroblasts will proliferate and secrete a long fibrous protein called the collagen protein. Right. These collagen protein will align together and form collagen fibrils. Now collagen fibrils will realign and form the collagen bundles. Okay. These have high tensile strength, but still the wound is not strong. Now is the maturation phase. Now these particular collagen fibers will continue to remodel, right? As well as they will continue to remodel and will strengthen the wound. Okay, and when they strengthen, the wound will contract. So that's how the whole process of the primary wound healing takes place. Now, factors affecting primary wound healing are nutrition, wound infection, anemia, hypoxia, radiotherapy, drugs. Now, So the summary that the points to be focused are there are two types of wound healing. Primary wound healing has the four stages, that is the homeostasis, inflammatory phase, proliferative phase, and the maturation phase. There are various factors affecting primary wound healing like nutrition, anemia, radiotherapy, wound infection, and everything. So these are the points to be focused. The reference is taken from a conscience textbook of surgery by S. Das. Thank you.